There are opportunities in this world to give support and provision to those in need, to serve people, to bring hope and promote the transformation of their condition of life. We at Thembalitsha are focused on this great cause within some of the previously disadvantaged areas of South Africa. The Thembalitsha Foundation has 3 legs: education, training and health. It is within these that we are to serve, support and build. Moved by deep compassion, the Thembalitsha Foundation understands the urgency and importance of reaching out to people infected and affected with HIV and AIDS. We are surrounded by precious people who are stigmatized, judged, and dying in guilt and fear, in many cases abandoned and hopeless. It is our vision to assist people to become all God created them to be, to show them the love of Jesus, and to give them a new hope. One of the legs of Thembalitsha, Themba Health, was started in 2002 and to date consists of 2 hospice palliative care centres. The first was started in Athlone, Cape Town, specifically aimed at babies and children dying of AIDS. Themba Care Athlone is an 18-bed paediatric inpatient unit with a home-based care division. Themba Care's function was to relieve the burden of children and babies dying alone and neglected in the nearby hospitals. Themba Care was established to afford these innocent young lives a place to die with dignity, where they would be loved and prayed for. Sadly, antiretroviral treatment was not accessible to the majority of South Africans at the time, and this resulted in many deaths and reinforced the hopelessness of having a disease that was terminal. The death statistics at Themba Care in the first year was 70%. Thanks to a number of UK organisations, some hospitals were able to open paediatric antiretroviral treatment clinics. Amazingly, we began to see a new, hopeful picture. Children respond miraculously to these drugs. With good nutrition, lots of love and attention, many of them at death's door were able to be restored to full health. The death statistics have dropped from 70% in 2002 to less than 2% at our unit in 2006. 50 kilometers eastbound of Cape Town is the town of Grabo. There are approximately 55,000 inhabitants in Grabo with an HIV rate of 34%. To add to this awful picture, Grabo has the highest rate of new TB infections in South Africa. For 55,000 people, Grabo has only 1 public day clinic, with the nearest hospital over 20 kilometers away. With this tremendous need, Themba Care began working alongside the day clinic in 2004. Themba Care Grabo supports many men, women and children who were looked after in their homes and given a new hope. From the time antiretrovirals were made available at hospitals, Themba Care has had one vision: to get everyone they could onto the antiretroviral program. Themba Care Grabo opened its inpatient unit in a small 3-bedroomed home on the 29th of March 2006. It only has 6 hospital beds, but in the first year has already taken care of over 120 people, men, women and children. Themba Care Grabo's community care division grows daily, with over 200 people on the books. The Themba Care Grabo house will always be used, but we know that we have been called to build an 18-bed hospice palliative care centre and an HIV/TB clinic alongside the day clinic to continue to reach out and minister to the precious people of Grabo. The Thembalitsha Foundation was birthed out of the knowledge that Jesus Christ came to this earth as a servant to seek and save the lost. He left us with an indisputable mandate to love God and to love our neighbour as ourselves. Our mission at Thembalitsha is to honour God and advance His kingdom through community development. Thembalitsha, providing health through caring.